Vitamin B6 deficiency is a condition that occurs when your body doesn't have enough vitamin B6, also known as pyridoxine. Vitamin B6 is one of 8 B vitamins that play crucial roles in our body. It is involved in over 100 enzyme reactions inside your body right now. It is used to convert food into energy. It helps create neurotransmitters, which are chemicals that carry signals between nerve cells. It's also involved in the formation of red blood cells and helps maintain normal blood sugar levels. Vitamin B6 is a water-soluble vitamin, which means our body doesn't store it for long periods, and we need to consume it regularly through our diet or supplements. Vitamin B6 deficiency is not as common as some other nutrient deficiencies, but it's not rare either. In developed countries, it's estimated that about 10 to 20% of the population might have a mild deficiency. However, severe deficiency is much less common. Certain groups of people are more at risk, including the elderly, individuals with alcohol dependence, and those with certain medical conditions. Causes of vitamin B6 deficiency. The causes of vitamin B6 deficiency are diverse and can be broadly categorized into dietary, medical, and lifestyle factors. Dietary causes are perhaps the most straightforward. If you're not consuming enough vitamin B6 through your diet, you may become deficient over time. This is more likely to happen in people following very restrictive diets or those with limited access to a variety of foods. Vegetarians and vegans might be at higher risk if they're not careful about their B6 intake, as many rich sources of this vitamin are animal products. Medical causes can be more complex. Some health conditions can interfere with the absorption or metabolism of vitamin B6. For instance, celiac disease, Crohn's disease, and ulcerative colitis can all affect the absorption of nutrients, including vitamin B6, in the small intestine. Kidney diseases can also play a role, as the kidneys help activate vitamin B6 in the body. Increased demand for vitamin B6 can also lead to deficiency. This is particularly relevant for pregnant or breastfeeding women who need higher amounts of the vitamin to support the growth and development of their babies. Other than medical conditions, certain medications can also lead to vitamin B6 deficiency. For example, isoniazid, which is a medication used to treat tuberculosis, can interfere with vitamin B6 metabolism. Some anti-epileptic drugs and oral contraceptives may also increase the risk of deficiency. Lifestyle factors can contribute to vitamin B6 deficiency as well. Alcohol abuse is a significant risk factor, as alcohol can interfere with the absorption and metabolism of many nutrients, including B6. Smoking has also been associated with lower levels of vitamin B6. Symptoms of vitamin B6 deficiency. The symptoms of vitamin B6 deficiency can be quite varied, reflecting the vitamin's many roles in the body. It's important to note that these symptoms often develop gradually and can be subtle at first. Here's what you might experience if you're deficient in vitamin B6. Number 1. Skin changes. One of the earliest and most noticeable signs is often a skin rash. This isn't your typical rash. It's usually red, scaly, and can be quite itchy. You might notice it first around your face, particularly near your mouth. It can spread to your neck and hands too. Some people describe it feeling like a bad sunburn that won't go away. In severe cases, the skin might crack and become painful, especially at the corners of your mouth. Number 2. Mood changes. You might find yourself feeling off emotionally. It's not just feeling a bit down. You could experience persistent feelings of sadness or anxiety that seem to come out of nowhere. Some people report feeling irritable all the time, snapping at loved ones for no apparent reason. You might also feel mentally foggy, having trouble concentrating on tasks that used to be easy for you. It's as if your brain is wrapped in cotton wool. Number 3. Fatigue and weakness. This isn't your normal tiredness after a long day. With B6 deficiency, you might feel exhausted all the time, even after a full night's sleep. Simple tasks like climbing stairs or carrying groceries might leave you winded and weak. Your muscles might feel heavy and uncooperative, making physical activities you once enjoyed feel like a chore. Number 4. Nerve sensations. As the deficiency progresses, you might start experiencing strange sensations in your hands and feet. It often starts as a slight tingling, almost like your extremities are falling asleep. Over time, this can progress to a burning sensation or numbness. Some people describe it as feeling like they're wearing invisible gloves or socks. In severe cases, you might even have trouble feeling the ground properly when you walk, affecting your balance. Number 5. Mouth issues. Your tongue might feel sore and look surprisingly red and inflamed, a condition called glossitis. It might feel like you've burned your tongue on hot coffee, but the sensation doesn't go away. You might also notice painful cracks at the corners of your mouth. These aren't just dry lips, they're deeper fissures that can make smiling or eating uncomfortable. Number 6. Sleep disturbances. Your sleep patterns might change dramatically. You could have trouble falling asleep, tossing and turning for hours. Or you might wake up frequently during the night, unable to get back to sleep. Some people with B6 deficiency report vivid, unsettling dreams that leave them feeling unrested in the morning. Number 7. Anemia symptoms. In more advanced cases, B6 deficiency can lead to a specific type of anemia. You might notice that you look paler than usual. Climbing a flight of stairs could leave you breathless and dizzy. You might feel your heart racing with even mild exertion. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of vitamin B6 deficiency. To diagnose B6 deficiency, your doctor will take a detailed medical history and perform a physical examination. They'll ask about your diet, any medications you're taking, and any symptoms you're experiencing. They'll also look for physical signs of deficiency, like the characteristic skin rash. The most common and reliable test for vitamin B6 deficiency is a blood test that measures the level of PLP in your blood. PLP is the active form of vitamin B6 in your body, so it's a good indicator of your overall B6 status. Levels below 20 nanomoles per liter are generally considered deficient, though some experts use a higher cutoff. In some cases, your doctor might order additional tests. For example, they might check your homocysteine levels. Homocysteine is an amino acid that's broken down by vitamin B6, along with folate and vitamin B12. So high levels can indicate a B6 deficiency. Sometimes a doctor might perform a tryptophan load test. This involves giving you a dose of tryptophan, an amino acid, and then measuring certain byproducts in your urine. If you're deficient in vitamin B6, your body won't be able to process the tryptophan properly, leading to higher levels of these byproducts. Treatment for vitamin B6 deficiency. The main goal is to restore your vitamin B6 levels to normal and address any underlying causes of the deficiency. For most people, treatment involves taking vitamin B6 supplements. These are available over the counter and come in various forms, including tablets, capsules, and liquids. Typically, doses range from 50 to 100 milligrams per day, but in some cases, higher doses might be recommended. It's important to follow your doctor's advice on dosage, as too much vitamin B6 can also be harmful. In addition to supplements, your doctor will likely recommend increasing your dietary intake of vitamin B6. We'll discuss food sources in a minute. If your deficiency is caused by a medication you're taking, your doctor might adjust your medication or prescribe a supplement to counteract the effects. For example, people taking isoniazid for tuberculosis are often prescribed vitamin B6 supplements as a preventive measure. For those with malabsorption disorders, treatment might involve addressing the underlying condition. For instance, if celiac disease is causing your B6 deficiency, adhering to a strict gluten-free diet can help your body absorb nutrients properly again. It's important to note that while vitamin B6 supplements can quickly raise your blood levels of the vitamin, it might take longer to resolve all symptoms, especially neurological symptoms like peripheral neuropathy. Food sources of vitamin B6. Vitamin B6 is found in a wide variety of foods, both plant and animal-based. Some of the best sources include: Number 1. Poultry. Chicken and turkey are excellent sources of vitamin B6. A 3-ounce serving of chicken breast provides about 30% of the daily recommended intake. Number 2. Fish. Many types of fish are rich in vitamin B6. Salmon, tuna, and cod are particularly good sources. A 3-ounce serving of salmon can provide about 35% of your daily needs. Number 3. Beef liver. This organ meat is packed with nutrients, including vitamin B6. A 3-ounce serving can provide over 50% of your daily requirement. Number 4. Potatoes. Both white and sweet potatoes are good sources of vitamin B6. A medium baked potato can provide about 25% of your daily needs. Number 5. Non-citrus fruits. Bananas are perhaps the best known fruit source of vitamin B6. One medium banana provides about 20% of your daily needs. Other good fruit sources include papayas and cantaloupe. Number 6. Beans. Beans of all types are good sources of vitamin B6. Chickpeas, or garbanzo beans, are particularly rich in this vitamin. Finally, remember, maintaining optimal vitamin B6 levels is not just about avoiding deficiency. It's about supporting your body's many vital functions and improving your overall health and well-being. Now we want to hear from you. Do you or someone you know have vitamin B6 deficiency? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.